My name is Malik, and my topic for the presentation is volleyball. First, we will begin with the type of injuries that are most common in the sport. The most common injury in volleyball is an ankle sprain. In volleyball, there's a lot of movement, stop, and jumping which occurs, and all it really takes is one wrong step or landing on your foot the wrong way in order to roll your ankle, and you'll end up with that. Another common injury, which players are vulnerable to, are fingers, such as fractures, dislocations, and tendon and ligament tears. Players are all vulnerable to this due to things such as blocking, setting, and digging. Another injury, which they are also vulnerable to, would be rotator cuff tendonitis, which is caused by the overuse of the body part as it's heavily serving and spiking the ball. Another injury that players are also vulnerable to would be patellar tendonitis, which is caused by forceful jumping, such as spiking and blocking the ball. Another would be tearing your ACL, which is common, and also you will feel a pop in your knee if it does occur. And there's no specific way for it to occur, but usually when it happens is an awkward movement and awkward landing. And then lastly, volleyball players are also vulnerable to low chronic back pain, which would be due to overuse of muscles or ligament strains during your activity. Next, we will be going over the type of protective equipment which is used or could be used to reduce the risk of injury in my sport, which is volleyball. And first, knee pads. They can be used to protect your knees while falling or sliding, which will reduce impact. Padded shorts are also used to protect your hips when you have to dive for a ball when you hit the ground. And other crucial equipment, which would involve pads and braces for your elbows, knees, and ankles, forearms, and even splints for your thumbs due to hitting the ball. Another piece of equipment which is also used would be volleyball shoes, which are good for the traction and jumping. Next, we'll be going over the type of training, coaching, or techniques which could be used to reduce the risk of injury in your sport. Techniques that can be used to reduce the risk of injury in the sport would be stretching, maintaining a well diet and drinking a lot of water for your overall health, maintaining your cardiovascular fitness and core strength, and making sure that you get enough rest for your body. If a tweak or even the smallest injury occurs in your body, it is also crucial that you should receive treatment for it so you don't have it re-aggravated and wait till it fully heals. One thing big that my sport does do to help prevent injury would be stretching before the events, games, or practices, which is good for opening up your mobility for the body and reduces the risk of injury. Next thing we'll be going over is what my sport can do better. And personally, I think that they could require things such as braces, extra padding, stretching, taping. And the big part about stretching is even when the players aren't playing, they should be doing it in order to open up mobility, and it will make a slimmer chance for an injury to occur.